Namaste. Welcome
Ah,
to a new series of Thought Habitat Speaks. So far, we have covered accomplished women, and then we covered a lot on healthcare and a lot on business, a lot on music, and a lot on politics. Now, as the time goes on, we find a lot of philanthropists who are voluntarily coming out and helping people during this COVID-19 scenario. So we thought a new series to felicitate such individuals should be brought in. And that is why we have this new series, COVID-19 Warriors. So to begin with, we have Mr. Sanjay Kaul, Kakini Building Humanities. So Mr. Sanjay Kaul has been spearheading a largely philanthropic activity which is helping which is helping thousands out there in Jammu and Kashmir, Delhi, Himachal, and various other regions across India. They have been providing COVID-19 kits to people whomsoever is suffering due to the shortage of essential supplies too, are being supported by Mr. Sanjay Kaul and his associated organization. So without much delay, let us hear something from Mr. Sanjay Kaul. Sir, welcome to the show. You know, it is really a big honor that when many of us dare to step out and bother to help people, some like you are really bold enough to step out and help everyone.
Thank you very much, Arvind. It is a pleasure speaking to you today, and I feel it and this an opportunity to put my views forward. Like when the COVID second wave, when it came and it strike, you know, struck us in such a, it was a surprise, and we around mid of April, around 10th, 12th April, we just got ourselves together. We formed COVID response teams at Delhi NCR and in Jammu thereafter. And we had three uh, ties which are working. One was who was working, the people who are taking the information where this help is required. Then we had people on the ground. We had kept around few vans on the ground which can help the people on ground. And what was everybody knows now that it was the oxygen supply and concentrators which are in huge demand. We had around 100 volunteers working on the ground during that period, and from 4 to 5 days, our people from Delhi used to go to Agra, Mathura, stand in line for the oxygen cylinders. We had procured around 25 oxygen cylinders, 50 liters, and people were standing in line. They have stood in line for 24 hours, 30 hours to just get the oxygen cylinder filled. And we had uh, tied up with certain COVID centers. There was a facility in Sector 61, Noida, SGM Hospital, where we had set up a facility with the help of Dr. Pushpa there, where 10 beds were there, and we were providing them the oxygen. We were providing the flow meters. And similarly, the concentrators, there was uh, so much of scarcity of concentrators that we had to move people all around the country where the need was the minimum. Like I got 4 concentrators shifted from Srinagar by air to Delhi. I got similarly concentrators shifted from Hyderabad, South India to Delhi those days. And then there's an organization, Kashmiri Overseas Organization, which also helped us to procure these concentrators. I am from the organization. Name of organization is Kakini Building Humanity. I am not from Kashmiri Overseas Association. This is the organization which came in contact with us later because they saw some work is happening on ground and they wanted our help. So this is how we started building up. We, along with the KOA, Kashmiri Overseas Association, supplied around 415 concentrators to the people who are in need. We also supplied to the elderly people. We were looking after the elderly people whose children were out abroad or were not here. Our team used to go in the morning, see that they are okay. We also supplied meals in Jammu to the COVID affected families. So a lot of work was done during that period.
That's really wonderful to know, sir. So much is happening out there, and such humanitarian works are really giving a reaffirming thought that humanity is not dead yet. There's still a lot happening. Okay. So, sir, I have a few questions for you. So, number one, as we all know, the third wave is coming. We really wish God forbid us that such a thing won't happen at least. But again, it is better to be precautionary than more optimistic at the given time. So, what is the estimated timeline for the third wave, and what could possibly be the casualties in Jammu and Kashmir, especially as you people have worked there a lot, in your opinion?
Uh, See, the thing is, we must pray and we must take steps in such a way that the third wave does not come the way the second wave came. During the first wave, it was believed that the younger population and lesser threat for the virus for the, remain, the younger population remain unaffected. However, during the second wave, a higher number of children, youngsters got infected, and now they are at larger risk of becoming severely ill in the third wave. That is what people say. That is number one. Number two, recently we heard some of the doctors, well-known doctors, saying that the way the things are going, the third wave is expected to come within 6 to 8 weeks. Now it depends on all of us whether, if we take precautions, if we do not go in the large gatherings, avoid melas, avoid get-togethers, and carry out the precautions like wearing of masks, COVID protocol, and most important, vaccination. So all these things should make the third wave. It is up to us how we make this third. We don't have this third wave coming on us. But you cannot. This virus is so unpredictable. Various variants are coming, so we had to be prepared for the third wave. When it is going to come, I have no expertise to tell when it is going to come, because there are people who are working on it. There are scientists, doctors, and they themselves are not sure. It depends on the human behavior, how the humans behave, how we open our borders to the rest of the world, how the states take it seriously. Because if it goes to the rural areas, it is going to be very devastating, because rural areas do not have the facilities which the metros have. The second wave created such a ruckus for the metros that if it's same thing going to happen in the rural areas, it is going to be a disaster. So it can come. People say it can come in October. I was speaking to some other experts the other day. They say it is a spring virus. It is going to come again in March, April. So with a lot of inputs, we must not spread unnecessarily rumors, but we must be vigilant. We must be ready to face whenever it comes. We should be prepared from today. to avoid this virus.
Okay, that's something it is in our hands, which we have to ensure that we don't get affected. So my second question is, unlike the first wave, the need for oxygen concentrators and all other medical equipment was high during the second wave, right? So on the similar lines, in your opinion, as you're on the field, you might understand. So what would be mostly required during the third wave? Like, is it going to be something beyond oxygen concentrators and so?
See, government has worked enough now, enough oxygen supply is available, concentrators are available, and a lot of other infrastructure which was dismantled earlier. The makeshift hospitals are coming up. So, from that point of view, we are much better prepared to handle the third wave. However, but I feel that if it is going to spread to the other areas like not second rank cities, remote areas. So what is required will be the paramedic persons, doctors, health workers, because these are not available. And if these people also get affected, that is what we may feel shortage of the doctors, we may feel shortage of nurses, we may feel shortage of the health workers. So that is what we have to work. We have to train, like we have got NCC in all states, all schools. We have to train certain people to handle the crisis in the third wave. I'm sure that government is doing their bit, and we are also trying to train at certain places. Like in Jammu, we are trying to train people about the code protocol. We are training them to spread awareness among the people. We are training them to convince and make sure that rumors are not spread, and people are not averse to vaccination. So all these things the organization like us can do. Rest, I'm sure the government is taking appropriate steps, and we will come out of this pandemic with victory.
Yeah, we're really hoping for it to happen soon, though. And sir, so as we saw, some specific regions had high concentrations. During the first wave, it all started first in Kerala, and then it expanded. I mean, it exponentially expanded in Mumbai, and from Mumbai to various other cities, from Delhi or Chennai or Kolkata or every other city for that matter. But when the second wave came, it was all of a sudden Delhi, Rajasthan, Chhattisgarh, Punjab, Haryana, and all these places. So, similarly, Jammu and Kashmir too has some high concentration areas where COVID-19 could be more. The cases of COVID-19 could be more. So, in that lines, which regions are in the risk of getting more cases?
There are some places like we have a place in Kashmir where there's a one room apartment for the people there. There's one, there are some camps for the people who have gone there for the work under Prime Minister's package. So they've got one room. So even if one room and one family is staying, so it will be very difficult for them to self isolate in those areas. So for those people, we as well as other organizations which are working on this, we are requesting the government to provide a school or provide a space which we make an isolation center there. That we have done at certain places in Jammu, that we have done certain places in Delhi, and some people are doing it in Kashmir. There's one Vinod Rana who has done it in Vesu, who has put up a school there, and we are helping him whatever we can. So at other places also, there are some doctors and some people in Srinagar itself have come up with a isolation center for the local population there. So we have to follow these COVID protocols wearing of mask, distance, if you feel there are symptoms, isolation, and in case it aggravates, so go to the, then report to the hospital. You should have, the people who can afford, you should have the oximeter or concentrator available uh, in case the things go worse. And at least you should have helpline numbers who can help you, because there are a lot of organizations, not only private ones, but government is also doing its best to help during these crises.
Okay, that's interesting to know, sir. And one final question. As you already said that social distancing and wearing mask and sanitizing your hands every time possible. So these are some of the precautions which we have to take. So in order to overcome the third wave, it is said that our kids are going to get affected. Children less than 18 are reportedly going to get affected due to COVID-19, we hear. So in that case, what precautions should we take, especially in a one-room apartment, as you said, if a family of 4 or 5 are going to live together, so they have to ensure everything is well sanitized and so. So in that way, what are the precautions that people should take to overcome the third wave?
See, to avoid the catastrophic consequences which can happen due to third wave, the vaccination should be our topmost priority, especially for the children who could be next vulnerable group. India has around 17 crore children in the age group of 12 to 18 age bracket. So vaccination is the prime thing we must do. And as an organization, what role we can play in the vaccination itself is, number one, the awareness campaigns. Vaccination in rural India remains a huge challenge. There have been incidents where frontline workers have been treated or attacked. They have been treated badly. The children in metros are aware, but a large section in rural area is influenced by the factors including perception, trust, belief, and rumors by anti-social elements. So to overcome this, we have set up awareness campaigns in remote areas of Jammu and Kashmir, Himachal, and even in Delhi NCR, where our teams go and make people aware and aware about the importance of getting vaccinated. Secondly, we are also tying up with certain hospitals to start a vaccination drive at certain community centers, and we are likely to commence that next week. So what I mean to say, that vaccination is very important. People must take vaccines, and people must encourage others also to take vaccines. Number three is we have started to maintain our equipment like oxygen concentrators, oxygen cylinders, and have organized them at places where they will be easily accessible if the third wave comes and people are aware. See, sometimes the equipment is there, but people are not aware. Now, fourthly, we are continuing with the awareness campaigns and distribution of COVID protection kits, which was quite hit. This was a very hit item during the peak days of pandemic. We do tell people that N95 masks N95 masks are a must, and we provide them at very nominal cost to the people. And most of the people who can't afford it, we provide them free of cost. Masks are going to remain, sanitizers are going to remain. They are the part of your body now. You must wear them, and that is the basic safety everyone must follow. Number five, what we did during the pandemic, and we are going to keep it standby now, is our tele consultation with doctors. Our teleconsultation with doctors was a very good initiative started by Kakini. And in this, you could dial this number to get access to doctors during the pandemic. And now again, we're going to activate it. It is still working, but now the number of doctors present are very less. Uh, on a positive note, I firmly believe that the third wave is likely to be well handled both by the government as well as by the organizations like us, because second wave has taught many lessons and led to a ramping up of infrastructure, including that for the oxygen supplies. The fact that we are caught unawares led to the aggressive gear up by all concerned. So that is what we feel that what an organization like us can do, and the government is doing its bit.
Okay, that's really wonderful to know, sir. With you all around saving us, we are pretty sure that we can comfortably come over the third wave as well. But with all the precautions to be taken, we really believe a third wave doesn't come. At
We
one
also
point in time, we pray that such a thing won't happen, at least.
all of us pray that it doesn't happen, and it is up to us, the people. Every individual is responsible that let this country come out of it. It is not only the prime minister's job or the government job, it is the job of every one of us. And if something goes wrong, it is not the government which is responsible, it is all of us Indians who will be responsible for whatever happens. Thank you.
Thank you so much, sir.
Thank you.
So
Thank you so much.
we are looking for more interviews from your end, and we'll be in touch with you.
Thank you. Thank you, Arvind Sundaram. It was nice speaking to you. Thank you very much.